Welcome, everybody, to our last and final episode with Professor Daniel Weintraub in this Park Impulse series. Next week, we'll be running a new episode with Professor Kay Redfield Jamieson, a world-renowned mood disorder expert from the Johns Hopkins University School of Medicine. Together, we will draw vital parallels between familiar disorders like mania and depression and the less recognized neuropsychiatric fluctuations and impulse control disorder that Parkinson's patients experience. My name is Bettina Rotzetter, and I am joined here today with Dr. Ines Debove to discuss the neurobiological link between neurology and psychiatry in PD with Professor Weintraub. On the contrary of what many may think, but Parkinson's doesn't only affect movement. That's why we want to learn how integrating neurobiological psychiatry perspectives can actually improve care, strengthen communication, and enhance quality of life for people living with Parkinson's disease and their families.
But I think, therefore, like you said, I think the collaboration is very important, and I think it's also important for the people and the patients and the caregivers to know it's not a shame to have a psychiatrist on board. It's nothing shameful. It's something which is important because it is a neuropsychiatric disease.
Yeah.
And I think this is something the colleagues should know, and I think also the patient and the close ones should know and be more aware of it. And I think, unfortunately, we are not there yet. I think we still need to do,
Yeah.
I think it's coming now, and there is a lot of work what was done, but
Yeah, I agree with you. That's one of the reasons I was interested in Parkinson's psychiatry was, in the general psychiatry world, we deal a lot with psychological issues, but it's hard to know what's causing that. In Parkinson's disease, in many cases, I think there is like a clear neurobiological contribution from prodromal symptoms where people can be depressed or anxious in the years leading up to a diagnosis of Parkinson's. And we just know that the brain changes that occur in Parkinson's can also link with psychiatric symptoms. So for me, it's a population that's easier to work with in general because I can often talk to patients and say, of course, there's a psychology to what you're experiencing, but there's probably also a very clear neurobiological component. I just think it makes the topic easier to address. And particularly when we're talking about impulse control disorders that are, largely driven by the medications they're taking.
Recognizing these neurobiological connections allows clinicians to better support patients and caregivers, as the brain changes and the underlying disease also contribute to psychiatric symptoms. We want to open the doors to more empathetic conversations about challenging issues such as impulse control disorders. Next week, as we've mentioned in the beginning, we will be starting the new episode with Professor Kay Redfield Jamieson, and we want to explore a bit more about mood and behavioral disorders in Parkinson's disease as a parallel. Thank you, everybody, for joining in on this episode and series with Professor Daniel Weintraub. Much thanks to Professor Weintraub for these in-depth conversations that are so important to help us explore different aspects and perspectives. Stay tuned and stay curious, and thank you, everybody. See you next time.